Order, order. We come now to the debate entitled on the question of E-petition 598732 relating to the future of the NHS. I call Matt Vickers to propose the motion.
Thank you, and it is an honour to serve under your chairmanship. I beg to move that this House has considered E-petition 598732 relating to the future of the NHS. I today have the privilege of putting forward this petition to the House for debate. I'd like to congratulate Marcus Hines, the writer of the petition, and a proud Unite member for achieving over 135,000 signatures. Marcus and other esteemed members of Unite shared their views ahead of this debate. The NHS is a truly British innovation, there to help us in our hour of need, supporting us from cradle to grave. The NHS has an enormous role in the lives, health and welfare of British people. As a result, it is rightly at the centre of much debate that takes place in this chamber, as we constantly look to how it can be expanded, improved and made more efficient. I'd like to begin by thanking the NHS and all its amazing doctors, nurses, staff and volunteers for what they do. Throughout the past 2 years, they have been the crutch that has kept this country upright. No words will ever be able to articulate how thankful people across the UK are for the work that they do for us every day. The NHS is a great British institution, founded in the wake of the war by a society that wanted better for everyone. It is, and always shall be, free at the point of use. The NHS carries the weight of our country's health problems on its shoulders, and that's why I'm delighted to support the government's ongoing commitment to it. The biggest cash boost in the history of the NHS. Yeah.
I thank the honourable member for giving way, and the honourable member referred to it being free at the point of delivery. Well, NHS Dentistry is on its knees. There's so many. I've got Rachel Elizabeth from my constituency of Weaver Vale. It's been waiting over 2 years. The same in Runcorn and Frodsham and so forth. I know my good neighbour as well in Chester, similar situation, and indeed Ellesmere Port, and right across the country. So would the honourable member agree that the NHS Dentistry is in crisis?
Do you know what? I've shared concerns from my own part of the world about NHS Dentistry, and I'm fairly confident that the Minister will fill us in and give a more extensive response than I. The NHS carries the weight of our country's health problems on its shoulders, and that's why I'm delighted to support the government's ongoing commitment to it. The biggest cash boost in the history of the NHS is allowing us to put thousands more doctors and nurses into our hospitals, coupled with major capital investment programmes which have already benefited my local hospitals. I know that the Minister is only too aware of my ongoing campaign to secure more sizeable improvements at North Tees. That said, I know from my own constituency in Stockton that there remains huge challenges for the NHS and its role in improving the health of the nation. In 2018, Stockton was labelled England's most unequal town by the BBC. It is a town where people born in one area can be expected to live 18 years less than those living just a few miles up the road. The health inequalities are not acceptable in modern Britain. The NHS rightly looks to prevention as well as cures, and furthering this course requires not just more resources and improved efficiency, but joined-up cooperation with other agencies, which lies at the heart of the reform agenda. Putting my experiences and observations aside, the lead petitioner, Mr Hines, and those from Unite wanted to let me know that they were fundamentally opposed to the Health and Care Bill. As part of their reasoning, petitioners cited concerns about the staffing crisis, about overwhelmed HR departments and the backlog as core reasons for their belief that the Health and Care Bill should not be brought onto our statute books. Petitioners shared their concerns about staff shortages and worker fatigue in an NHS that already stretches itself to meet the needs of the UK's ageing population and the exponential growth in the health needs of the public. They talked of how the pandemic has compounded this problem. Moreover, the pandemic paused elective surgery, leaving the NHS to deal with backlogs and extended waiting lists. The view of petitioners was that the NHS should be given time to stabilise and respond to these challenges before taking on the challenges of reform. On a more institutional level, Unite said they feared that this bill would open the NHS up to deregulation, worsen staff shortages and create a for use system akin to America. The petition stated that the government has no democratic mandate to privatise the NHS. I agree. The government has no democratic mandate to privatise the NHS. That's why it's doing no such thing. Access to NHS services shall continue to be based on clinical need, not an individual's ability to pay. In my view,
bringing this forward, but just again put to him and perhaps maybe a challenge to the Minister and to Government is that we're not careful with the NHS as it is today. We all love the NHS, we love the workers, we love what it does, but if we're not careful, it could come to a stage where you haven't got the money, you can't pay for your care. And does the honourable gentleman not agree? If that was to happen, then the whole principle of the NHS is knocked in the head.
Yeah, I would say this isn't a debate we have at every election campaign. And other than the issues around dentistry, which I'm sure we're going to go on to, the NHS remains free at the point of use. And do you know what? I'll fight the corner to keep it that way, and I'm sure that he will. Yep.
To him giving way. I think everybody in this room would agree with the principle that the NHS was founded on about care free at the point of use. But the NHS has had many structural forms since its inception, immediately after the Second World War. My concern is the current form and the proposals that the government are bringing forward further centralise the NHS and further waste money on bureaucracy mimicking the private sector and an artificial market. Does he agree with me that that is a waste of money and the NHS should be decentralised in order to provide better services to local communities?
Yep, I'm sure we're going to hear about the way in which these structural reforms will take place with that very aim, in my view. I'm going to try and get through it because I'm sure you'd prefer to, A, everybody to get in, and B, to hear from the Minister, who I'm sure is more wise on the issue than I am. In my view, the Health and Care Bill does not represent an attempt to create a pay-for-play system. Quite the opposite, while I'm sure the Minister will go into depth on this particular point in his response today. My understanding is that the Health and Care Bill is largely the work of the NHS itself, inspired by NHS England's own desires to restructure their organisational system to be more efficient and effective. It builds on the NHS's own long-term plan set out in 2019 and the NHS People Plan published in 2020. Many of my conversations with leaders from my local NHS trusts suggest the answer to improving health outcomes require multi-agency working and empowerment of local health agencies. My understanding is that these reforms and structural changes set out to do exactly that. One point I would strongly agree with petitioners about is the need to drive value for money within our NHS, reducing management costs and excessive use of consultants so that the huge increases in funding for our NHS can actually reach the front line and not just fund more fruitless layers of bureaucracy. I'm hopeful that the Minister will update us on what is being done to drive efficiency in this regard. Another point, which I fundamentally agree with, is the petitioner's view that PFI contracts have no place in our NHS. I know all too well the debilitating effect they have on the ability of the NHS to administer care across our country. Nationally, PFI contracts cost our NHS £1 billion a year and restrict numerous hospitals across the breadth of Great Britain. I've seen firsthand how it has damaged our local services in the Tees Valley. South Tees, in particular, has been plagued by a dodgy New Labour PFI contract. James Cook University Hospital was completed in 2003, but their PFI contract does not run out until 2034, and it will cost them over £1.5 billion. The Trust currently has to meet annual payments of £57 million a year. That's more than £1 million every single week. Now, of course, hospital upgrades and rebuilds are expensive, but the Trust is paying £17.5 million over and above what an equivalent Treasury-funded hospital would cost annually. Shockingly, that is enough to pay for over 530 nurses. 530. It's ludicrous. Even if there were not an extra 530 nurses at South Tees, there is so much the hospital could do with this money, investing in its building, equipment and staff to help improve health outcomes and inequalities. Excessive costs from its historic PFI are listed as the largest single contributory factor to its troublesome financial position. At a time when NHS retention is a huge issue in our NHS, this money would be crucial for making a substantial difference to the working lives of our NHS heroes. I'm glad that in 2018, a Conservative government decided that PFI contracts would be phased out. Yet hospitals up and down the country are now stuck dealing with this Labour legacy, which has damaged our NHS, our people, and the ability to tackle health inequalities across this country. I look forward to hearing the rest of this debate and I'll carry on, I'm sure you're going to get the chance to make your comments, and to listening to the input of members across the House. Thank you.
Petition 598732, relating to the future of the NHS. Honourable members will see by a glance around the room how many people are trying to speak, and therefore I don't intend to impose a formal limit, which seems to me to sacrifice quantity in favour of quality, all the way around. But I do suggest to members, as a courtesy to each other, something like 3 minutes each would be sensible, if that's at all possible. Christian Matheson.
Thank you, Mr. Craig. It's a great pleasure to see you in the chair this evening. Actually, there were a couple of aspects of the honourable gentleman's from Stockton's speech for which I congratulate him that I agree with. First of all, I don't support PFI either. I think history might suggest to us that although that hospital was completed and perhaps started during a Labour government, the PFI was originally a Conservative initiative under the major government. So I wouldn't be too, wouldn't be too confident about attacking it, but I'm pleased that it's gone. The other thing that I profoundly agree with was his support for NHS staff, and I think we'll be hearing a lot of that this evening, Mr. Great. The NHS is recognised and it's envied around the world, something we should celebrate and admire, and something we should, and not something we should chop up, neglect and sell off piecemeal at every opportunity. It's the NHS and its staff that are getting us through this pandemic. I'd like to take this opportunity, as I'm sure all honourable members would, to once again thank the NHS and care staff who have worked so hard and sacrificed so much over the last 2 years. However, the NHS cannot continue to look after us if we don't look after it. Tory mismanagement over the last decade and the pressures of the pandemic mean that the NHS is running on empty and surviving solely on the goodwill of its employees. Even before the pandemic, we were seeing record waiting lists and staffing shortages. Now the numbers are through the roof. I will give way to my honourable.
Very much. Just very briefly, you mentioned that the NHS is running on empty. Of course it is. A recent Unite survey in January 2022 showed that 77% of the NHS workforce believed that they're worse off than they were the year before. 55% are working during their lunch breaks, and more than 50% are working in excess of their contracted hours. Is it any wonder that the NHS is running on empty?
Well, I couldn't have put it better myself, but as I say, it's running on empty, but also on the goodwill, Mr. Gray, of the staff, because they believe in the NHS and they believe in what they're doing. The numbers are now going through the roof. The number of people, of 6 million people on the waiting list in England in November, was the highest ever recorded. And in my own constituency in Chester, the latest figures show 36,000 people are waiting for care at the counters of Chester Hospital. These record waiting lists are also true for NHS dentistry, as my honourable friend and next-door neighbour in Weaver Vale has pointed out. Some people are being told they may have to wait up to 2 years for an NHS dental appointment. Over the past few months, many of my constituents have told me of the difficulties they've had in finding and accessing an NHS dentist in my constituency and in the surrounding areas. On average, there are only 4.4 dentists per 10,000 people in England, and this number is shrinking. With shortages of staff, lack of funding, the pressures of the pandemic and dissatisfaction with NHS dentist contracts, the waiting lists are growing, and many dental practices are feeling the pressure to turn private just to be able to cover wages, equipment costs and survive as a business. Dr. Simon Gallier, who owns a dental practice in my constituency, wrote to me with a heavy heart that he has had to make this difficult decision to take his dental practice private earlier this month and had to inform over 7,500 patients that they will no longer be receiving NHS treatments. It is not something practices around the country are doing by choice, but rather out of necessity and lack of funding. Dr. Gallier just can't make ends meet. Indeed, in the last year for which figures were available, 18 to 19, the amount spent on dentistry fell in real terms compared with the 6 years previously. Whereas the £50 million announced recently by the Minister is welcome, only £7 million of that will go to dentistry in the North West, which is clearly insufficient when we're talking about a national budget for England that was over £2 billion in 2019. With fewer NHS dental practices, many constituents have no choice but to go private, an option many will not be able to afford, especially compared with the cost of living crisis we're facing. I do worry that this has been the Tory master plan all along. starving the NHS of funding, resulting in inevitable backdoor privatisation, or perhaps a more sinister scheme, monetising dentistry as other similar services such as some GP practices or many vets practices have done. The dentists can't afford to operate under the NHS, so they sell the practice to an umbrella company, which is the front for a finance company. These then offer quasi-insurance or membership programmes where the patients pay an amount every month which entitles them to an annual cheque. But that stream of money from numerous different practices becomes a valuable commodity in the City of London, which is, of course, where the current Conservative Party exists to serve, along with Putin-linked Russian oligarchs, but we won't mention that now. When we talk about privatisation, this is what I fear. Not the sale lock, stock and barrel in a public flotation like in the 1980s, but bit by bit, behind the scenes, to private companies who extract money for their profit, money that must surely instead be spent on patient care. Mr Gray, NHS dentistry is in crisis. I will not look that £50 million gift horse in its mouth, but let's be clear, much more is needed.
Yeah. To serve under your chairmanship, and I was very proud that so many members in Hornsey and Wood Green signed up to this important petition about funding for the National Health Service and about keeping it in the public sector. The National Health Service, there is no doubt, is the most popular public service in my constituency, but there is a basic lack of staff, whether it's at a very primary care level in terms of the numbers of GP and other practice staff, which always seem to be looking for more staff, whether it's the 40,000 national figure of nurses which is in desperate need, or whether it's the thousands more doctors that we need. And compared to other European countries, we simply do not have the correct ratio of patients to doctors. Just to give one example, in psychiatry, we have increasing numbers of patients, particularly following the stresses and strains of coronavirus, waiting days and days in a hospital bed to see a consultant. I heard one story this week of a patient who waited for a doctor's round, which took 10 days for her to be seen, and that is using a bed for a very long time without having the correct medical attention. Many other members today have mentioned the insufficient funding for dentistry, and in my constituency in Hornsey and Wood Green and across all of Haringey Borough, we have sadly some of the worst caries in children's teeth in Europe. As the member for Wisbech said, 77% of staff in the NHS believe they're worse off this year compared to last. We know that there is a working in excess of hours, that hourly pay since 2010 has either been frozen or increased by just a tiny increment, which does nothing to cope with the challenges of the Tory-driven cost of living crisis, whether it's domestic fuel bills, the cost of food, the cost of children's clothing, the cost of the basics of travel, getting to work, or the cost of petrol to drive to work. One final point I would make, there is a social care bill going through at the moment, and of course the social care element to fix the bottlenecks that we get in the health service is so crucial. We need a properly funded care system where the hourly rate is correct according to the need of the people working in it, and that we need also to see that overall management of getting people into the right sort of care as quickly as possible could free up the National Health Service to look after those who are coming in the other end through accident and emergency. It's a very basic point which every member in this debating hall has made on a number of occasions, but it still seems that this government is sitting on its hands and failing to address this crucial question of how we get that flow through the system. And of course it does come down as well to terrible cuts to local government, and if local government was adequately funded, we would see much better and a much more proportionate system. I'll stop there, Mr Gray, because I know that many other members wish to make a contribution.
Yeah, well,
Zane.
Thank you very much, Mr Gray, and it is, of course, a pleasure to serve under your chairmanship. Time not permitting, can I firstly echo the excellent points made by honourable members for Chester and for Hornsey and Wood Green in particular, and I certainly put myself and align myself with the points they've made. I want to concentrate on two areas in particular that are of huge concern to my constituents. Firstly, as the point has been made around privatisation. 3 years ago in Bradford, I fought alongside trade unions and NHS staff to stop plans to introduce dangerous backdoor privatisation into our local hospitals. And whilst we beat these plans for moving key services out of the NHS and placing them in the hands of private companies, the danger of privatisation in our NHS in Bradford has not passed. Instead, this threat has only grown under this government's health and care bill, which, whilst removing enforced competition, does nothing whatsoever to roll back the wave of privatisation that successive Tory health ministers have unleashed upon our NHS over the last decade. Rather than improving patient care, this bill allows private companies who have a vested stake in driving greater privatisation in our NHS to sit on local health boards, making decisions about our healthcare, not with patients at the forefront of their minds, but simply profits. Mr Gray, there is no greater threat to the future of our NHS, free at the point of use and in public hands, than this bill and the Tory government itself. And we must stop both before it's too late. Mr Gray, we also have to look at what the future of our NHS in terms of GPs, who are at the coal face of healthcare, but are all too often overlooked. Each week in my constituency, without fail, a worrying number of constituents come to me to tell me that they have been unable to get any form of appointment, let alone a face-to-face appointment with the GP, to tell me that they've been left on hold when calling, waiting for phones that are never answered, and tell me that when they were given an appointment, it was weeks away, even when it's an urgent issue that simply couldn't wait. And I'll give two examples of that I've had this week. This week, I dealt with a case where a son with an elderly mother who was 82 years old went to accident emergency, was sent back and told to go see her GP the next morning. The son started ringing the GP practice from the first thing in the morning. When he eventually got through hours later, he was given an appointment for 2 weeks later. The other case involving very similar circumstances, again, was told to wait for weeks. This, frankly, is unacceptable, and this level of service anywhere is unacceptable. But in Bradford, where we have higher rates of deprivation, where life expectancy is below the national average, and where we have a greater rate of preventable illnesses, it is beyond serious and can even be fatal. No one should have to wait for more than a fortnight for an appointment, and certainly not for urgent cases. But when the inner city of Bradford, which has one of the worst GP to patient ratios in the country, then this comes as little surprise to me. Yet whilst fewer GPs forced to see more patients explains the scarcity of appointments, it does not, and I'm clear about this, explain the poor level of service that patients in Bradford are reporting to me. So let me use this debate today also to put on notice those practices which are frankly letting down their patients. And I want to be clear, there should be a better service to ensure that urgent cases receive urgent appointments and to help close the health inequality gap between the richest and poorest in Bradford. My final point, Mr Gray, is I heard the honourable gentleman who opened this debate, and he made a speech that inferred that he was anti-privatisation. And I say this to the honourable gentleman, and I say this to all those on the government benches. The reality is, over the last decade, we have seen an ideological, intentional attack on our NHS. And let's not beat around the bush. If the honourable gentleman and others wish to stop the backdoor privatisation in our NHS, then what they should be doing is opposing the Health and Care Act. And what we need is for any form of privatisation to be taken out of that, not the smoke and mirrors that we see with the current legislation. Thank you very much, Mr Gray.
And I speak in full support of today's petition. In the time that I have, I'd like to make particular mention of the recent Health and Care Bill. Now, the clearest example of what could happen to our NHS if this bill goes ahead actually lies in current NHS dentistry. Indeed, net government spend on general dental practice in England has been cut by about a third in the last decade, and the results of this are stark, with reports of people resorting to pulling out their own teeth because they can't afford private treatment. And the British Dental Association states worryingly that the Health and Care Bill worsens the situation and does not ensure that the voice of 3/4 of NHS primary care professionals will be heard in the making of commissioning decisions. So whose voices will be heard then? Well, the bill would put private companies right at the heart of NHS decision-making and service delivery on the new integrated care system boards, where they will be given decision-making powers over people's care and how NHS money is spent. It will allow the awarding of contracts for clinical care to private healthcare providers without considering any other bids. And as the doctor-led campaign organisation Every Doctor stated, this bill will embed private companies in the NHS in England and give them power to decide who gets what treatment and when. So the government benches might wax lyrical about the NHS being free at the point of use, but what happens when people can't access the care they need, whether it's because of rationing or lengthy waiting lists due to lack of funds, or simply because those with a seat at the integrated care system board table determines that their care shouldn't be available on the NHS because it's just not profitable enough? Well, the result is, if a person can't afford private medical cover, they don't receive treatment. It's already happening in NHS dentistry, where it's been normalised. And the risk is that it will be normalised throughout the whole healthcare system. So, Mr Gray, let's be clear, this was not a bill to tackle the crisis faced in the NHS. It's not a bill for patients. It's not a bill to tackle the care backlog or to properly fund our NHS. It's a bill to reduce our rights to access healthcare and to privatise our NHS. And it must be scrapped.
Yeah,
Thank you.
well done, well done. Oops.
Thank you, Mr Gray. I want to begin by praising all the staff in the NHS who, often at enormous personal risk to themselves, have provided the dedicated care to so many of us over the past 2 years. The Minister must know, and the government should acknowledge, that they're exhausted. As a country, we must now show that we care for them, all of them, as they now turn to address the backlog of over 5 million people waiting for treatment. That care must be more than warm words, more than clapping. It must be tangible, it must be financial, and it must be realistic. That means an expanding workforce capacity, both in beds and staffing, to reduce the pressures our NHS heroes are actually facing. It means meeting the capital maintenance backlog of more than £9 billion. It was a dereliction by the Chancellor to entirely omit any funding for the infrastructure and building repairs when announcing the NHS's settlement. So there are two futures for the NHS: the disastrous one contained in the Health and Care Bill, or the one that integrates health and social care in an efficient, comprehensive service that is free to everyone from cradle to grave, whatever their medical need, that is delivered entirely in our public sector and accountable, and it's delivered by staff who are fairly treated and properly rewarded. And in that, I want to pay tribute to all the unions, and particularly my own union of Unite, for the work that they have done to ensure that that be the case. By comprehensive, I mean it should include mental health. It should include public health. If the pandemic has taught us anything, it should be the importance of public health. Yet, the ICBs have no delegated places for directors of public health, or for the mental health, or for adult social services. There's not even a place for the voice of the patient, around whom everything should be centred. By efficient, I mean it must deal with the backlog of 5.3 million patients currently waiting for treatment. By whatever their medical need, I mean it should definitely include dentistry, as we've heard from my honourable friends. By accountable public service, I mean there should be no conflict of interest that allows a private company sitting on the ICB commissioning contracts it will then be able to benefit from. In 2012, I railed against the imposition of Section 75 because it put competition rather than cooperation at the heart of our health system. I thought correctly, as it turned out, that this would give rise to increasing privatization and rationing of care and lessening of access for patients to the care they need. Putting competitive tendering at the heart of the service destroyed trust. It introduced the profit motive rather than successful medical care outputs. So it may be wondered why the reversing of the Lansley Bill would be of concern to me. Well, none of us could have conceived in 2012 that by doing away with competitive tendering, we might actually see not less privatization, but more of it. That is, unregulated by the tendering process. In 2012, we couldn't have believed that we would see VIP commissioning routes where contracts for billions of pounds, billions, not millions, were given out in contracts for medical equipment to friends of ministers. But that is what we are facing in this bill, putting that ability into legislation. And that is why this bill should be stopped.
The impact of the Health and Social Care Bill is limited on Wales, but I come to speak today because over 150 of my constituents signed this petition and because it is right to defend the NHS across the UK as a publicly run service in the way the great Welsh hero Nye Bevan intended. And I've got real concerns about the situation, both for the health service and the care sector, both in England and in Wales at this moment in time. Now, the King's Fund has estimated that NHS commissioners spent £9.7 billion on services delivered by the private sector, which represents around 7% of NHS revenue spending. At the same time as we hand over the NHS provision to the private sector, waiting lists are going up. Waits for treatments are getting longer. NHS pay is going down, staff sickness is going up, and staff vacancies are going up. The bill does nothing to address that and will indeed make it worse. Many of my colleagues have already set out concerns in particular about the new integrated care boards and the increasing role for the private sector on those. The bill will also reduce oversight of how contracts are awarded, moving the NHS from a regulated market to a less regulated one. However, I also want to say something about the care sector, because the bill will do nothing to improve social care. It's been 2 years since the Prime Minister stood on the steps of Downing Street and promised a plan for social care. When are we going to see that plan? Unison has found that more than 2/3 of care staff said they were so busy at night they only managed to get a couple of hours sleep, and staff are sleeping on makeshift beds in offices. A quarter of the workforce are on zero-hour contracts, and only about 10% are getting the real living wage. So why is this Tory government continuing to fail our social care sector and the recipients and its workforce? I stood in 2019 on a manifesto that pledged to establish a national care service. That would have been a historic development along the lines established in the NHS in 1948. But regrettably, we are not in a position to implement that. I finally just want to make a few comments on the position in Wales, and I suggest that people look at Welsh Government, because in spite of Tory austerity governments and years of underfunding, we have successfully achieved to retain a largely public sector NHS, We've got free prescriptions, and we're now proposing significant extra funding to local authorities to help with maintaining and developing the social care sector. Last year's cooperation agreement and the programme for government in the Welsh Senedd committed to the implementation of the real living wage and, yes, to establishing a Welsh National Care Service, which is going to be implemented by the end of 2023. Before Christmas, the Welsh Social Services Minister, Julie Morgan, pledged the Welsh Government would provide Welsh local authorities and health boards with £43 million so they can implement the real living wage from April. And that's a real living wage, not the one that the Tories are proposing. So I'll just finish by saying that I want to reiterate my support for those campaigning to defend a publicly owned, publicly run NHS and all those campaigning to deliver a similarly public national care service. We are trying to do it, and we will achieve to do it in Wales, despite the barriers put up against us by the Tory government. And I really hope that we'll have a Labour-led government in Westminster soon to do the same. Thank you very much. Diolch yn fawr.
Pleasure to speak in this, and I concur with the comments of others who have spoken beforehand. I also want to do, as the honourable gentleman did, acknowledge the incredible work of all healthcare workers across all spheres of the health system over the past 2 years through this pandemic, and the commitment and dedication they have all demonstrated throughout this public health crisis is, of course, not unique to the pandemic, but it's a defining characteristic, I believe, of all those staff who our wonderful National Health Service produced. And each one of us here today are here to say thank you to them from the bottom of our heart. So I commend the NHS staff who have been working hard day in and day out to make sure that their parents are looked after in the same caring way they do in normal times. And I think it's important too that we acknowledge the sacrifices made by their families, nurses and doctors who have been called in at short notice when wards and A&Es have been short-staffed. Many of my constituents do that every day, and have done it almost every day through the crisis. Many only just having left a long overnight shift themselves. I know that many saw very little of their families during the times. We tend to take it for granted that our NHS staff will go above and beyond to serve the public, and that should make us even more proud of them. But I think it's also there's an onus in this House, and I believe with respect to the Minister and to our Government, to ensure that we deliver for our staff for all that they have done. The NHS, as we know, is very different in the scope of service that was delivered than its inception of the 5th of July 1948. I'm certain that Florence Nightingale walked its corridors today. She'd been more than impressed with how far delivery of medical services have advanced, but she would also see the familiar aspects of local doctors delivering a first-rate service in community hospitals. These building blocks remain unchanged, and as our NHS looks to the future, it's vital that these foundations never change. The NHS is core and central to our society. We don't want it to be Americanized, and we all know what that means. It means you pay for it, because that would be the wrong thing. The people that I represent and the people that we all represent here, we have a duty, I believe, to deliver for them without having to gauge whether their wage packet can pay for it or their wallet's big enough. The future of our NHS will be supported by revolutionary technology, just as revolutionary as were the first penicillins when they were what seemed to be miracles. So we don't have a crystal ball, but we can certain that increased funding will be necessary, Minister, I believe, to support the radical adoption of innovative technology, improve resources, and without question pay, as the Honourable Lady says, pay our NH staff a wage that reflects the work that they do, they've done and will do for the future. I conclude with this, and very conscious, Mr. Chairman, to work to 3 minutes. Today, GPs and hospitals are under severe pressure, and I believe this will not cease for the next generation of GPs and NH workers. What we as policymakers need to do is to ensure that the original building blocks of the NHS that we cherish are in place in the future, is to build firm bridges between now and then. Most importantly, the NHS of the future must have the same ethos of care and compassion at its core, as much as in 2050, where we may not be here, Mr. Chairman, as at the beginning of 1948, when I wasn't here either. Thank you.
This evening. It's truly extraordinary achievement that we have the National Health Service, and we're so indebted to Nigel Bevan and all of those people who fought for it, and I pay tribute to everyone who signed the petition that we're discussing today. The petition refers to the Health and Care Bill, quote, locking in privatisation and dividing the English NHS into integrated care systems.
So we know, if enacted, we can expect to see the NHS split up into 42 locally managed health systems, which will be required to balance the books each year, rather than a National Health Service responding to patient need. Following intense pressure from Labour, campaign groups and other stakeholders, the Government has conceded that anyone, quote, who could reasonably be regarded as undermining the independence of the NHS because of their involvement in the private healthcare sector won't be able to sit on ICBs. However, such individuals will still be able to have significant influence through a complex array of subcommittees, including place-based partnerships and provider collaboratives. It's there in black and white in NHS guidance, quote, the Health and Care Bill, if enacted, will enable ICBs to delegate functions to providers, including, for example, devolving budgets to provider collaboratives. This exposes the Government's real intentions about increasing the involvement of private companies in the running of the NHS. The bill also includes measures to revoke the national tariff and replace it with an NHS payment scheme. As private providers would be consulted on the NHS payment scheme, it would in effect give them the opportunity to undercut NHS providers. I am very concerned that as a result we will see more and more healthcare being delivered by the private sector rather than the NHS, with money going into shareholders' pockets rather than being spent on patient care. If that happens, NHS staff could see themselves forced out of jobs that are currently on agenda for change rates of pay and the NHS payment scheme, with only private sector jobs available with potentially far worse pay and conditions attached to them. I'm concerned too that the bill would lead to an increased rationing of services because ICBs would have strict financial limits each year, and once that money had been spent, patients would have to wait longer or go without treatment. Some may be tempted by the adverts for private healthcare that we are increasingly seeing, but it's worth taking a look to where this path leads. According to Will Russell, a provider of international health, life and income protection insurance, the average annual cost of health insurance in the USA is an eye-watering $7,470 for an individual and $21,342 for a family. These are bills that employers typically fund roughly 3/4 of, thus creating a massive burden on business too. The average cost for an individual purchasing their own health insurance is $456 per month in the USA, according to a 2020 survey by eHealth. In this country, we can only imagine just how devastating such costs would be to individuals, businesses and the economy. We cannot afford to let such a system take hold here. We must defend the NHS as a universal comprehensive national service, there to treat us when we need it. Time is running out, and I urge MPs across the House to appreciate just how fortunate we are to have the National Health Service, join the campaign against NHS privatisation and oppose the Health and Care Bill.
Mick Whitley.
Thank you very much, Mr Gray, and it's a privilege to serve under your chairmanship and to follow the very powerful contributions that my honourable friends have made so far tonight. I also draw my attention to the entry in the Register of Financial Interest for ongoing links with United Union, which has played such a central role in the fight against privatisation of our health service. I'm enormously grateful to the hundreds of people living in my constituency who put their names to this petition, and the countless others who got in touch to ask me to speak in this incredible, important debate. They know that this government so clearly does not, that these are totally wrong reforms at the very worst time. Our NHS is in the midst of the darkest day of its long history. Exactly 2 years since the day the first COVID patient was admitted to a UK hospital. Morale is collapsing, staff are past the point of exhaustion, and many frontline services are at breaking points. And for all the government's talk of life after COVID, the virus continues to stalk hospital wards across the country, with 85 patients died within COVID in the last day alone. But instead of doing anything within their power to tackle a catastrophic staffing shortage and record-breaking backlogs, ministers instead seem intent on forging ahead with reforms that threaten to open the doors of our precious health service to ravenous multinationals interested only in making a quick buck and not in addressing the country's health needs. We should not be surprised that the government has so cynically sought to exploit this crisis to advance an agenda of privatisation and fragmentation. After all, this is really the logical next step of a project that has consistently been put forward by successive Prime Ministers and Health Secretaries since 2010. When the last Labour government left office, it entrusted to the care of the Conservatives a health service that was by every conceivable metric well beaten. But despite the best efforts made by our healthcare heroes, the NHS entered the pandemic woefully unprepared and under-resourced, having had its resources and resilience sapped away since the passage of the 2012 Health and Social Care Act. Now, I fear that the government's latest reforms, including the introduction of integrated care systems and American-style healthcare management systems, will leave our NHS in a far worse state when confronting the public health challenges of the coming decades. Mr Gray, I urge the Minister not only to listen to what was said today, but also to take heed of the public anger surrounding this issue. The British people are not in the least convinced by the claims that this government has the NHS best interests at heart, and they're looking anxiously towards America as a sign of what might yet come to be. They want an NHS that lives up to its founding principles as a public service, that it's free and accessible to all. And that's why ministers must return to the drawing board. Thank you, Chair.
Thank you, Mr Gray. It's a real pleasure to serve under your chairship, and it's wonderful to hear all these passionate speeches today. We need to be clear about this. The Conservatives, whether they admit it or not, have always had a problem with the National Health Service. They might try and rewrite the history books, but the truth is recorded that they voted against the creation of our National Health Service on more than 20 occasions. And the reason is purely ideological. The reason is the fact that they see it as an unwelcome intervention into the market, a point I'll return to in a second. Some of the more vocal supporters of this neoliberal agenda see the NHS as a kind of last bastion of socialism in our society. I'm proud that our National Health Service was created by a socialist, and I think that our National Health Service is the greatest example in this country's history of socialist principles put into practice. What does that mean? It means that there are some things in life more important than the pursuit of profit. But what we now see, and we've seen since 2010, is the increased drive for the Americanization of our National Health Service. They want to turn it into a system where they feel for your wallet before they feel for your pulse. But the truth is, however the history books were rewritten, it was a struggle to create the NHS in the first place. But it's a great struggle now to maintain the National Health Service in accordance with its founding principles. There are two key issues relating to our health service: deep underfunding and a greater use of the private sector. And they go hand in hand. Underfunding the National Health Service so people can be persuaded to stomach, supposedly, a greater and greater private sector involvement. First, you defund things so people get frustrated, and then you say there's no choice but to hand it over to the private sector. That's the plan. And we hear from the Conservatives that the staffing crisis in our National Health Service was caused by Omicron, was caused by COVID. The truth is that the huge vacancies and understaffing in the NHS didn't start with Omicron, didn't start with COVID. It's been there for a long time. Nearly 100,000 vacancies. An unbelievable £100 billion has gone to non-NHS providers of healthcare over the last decade alone. Every pound spent bolstering the private companies means less spent on people's healthcare as the profits are creamed off. And we've got to say that people are right out there to be worried about what the Conservatives want to do with the NHS. I mentioned earlier the Conservatives' historic and ongoing objection to interventions into the market. But the truth is they believe in a free market for the 99%, and all the harm that brings them in their lives, in their pay packets, in their health service. But they believe in intervention in the market for those at the top, for the benefits of those at the top. And that's what we saw during the COVID crisis, with all these corrupt contracts, with a VIP fast-track lane, with all that money, billions of pounds going to Serco for the failed test and trace. Well, what the Tories did with the corrupt COVID contracts, they want to do right across our National Health Service. That's why the health bill would be better renamed the corporate takeover bill. We can't allow that to happen. They want to create a race to the bottom. We know that cuts and privatisation go hand in hand. And a word before I finish about our NHS staff. We saw the Prime Minister, who no one trusts anymore, and quite rightly so, standing outside Downing Street, clapping for the NHS heroes. Well, claps don't pay the bills. If we have a government that values NHS staff in the way that they say they do, then they need to pay them properly. And I want to put on record my support for the 15% pay increase for NHS staff who have suffered a decade of real-term pay cuts. And we need to be clear about what that means. That 15% pay increase would bring their pay back in line with where it was a decade ago. So what's the way forward? The way forward is for us to realise that no Prime Minister is going to say, and no government is going to say to the public, do you know what? We're going to privatise NHS. Do you know what? We're going to turn it into an American-style healthcare system. Of course they're not going to do that. They're going to manufacture consent for these changes through underfunding and through creeping privatisation, carrying on at ever greater pace. As I say, it was a struggle to create our NHS, and it will be a struggle to save it from final Americanization. But regardless of which party we're in, history will judge us poorly if we betray those who went before us and created our National Health Service, the greatest achievement in our country's history and the greatest example of socialist principles put into practice, which is maybe why this government dislikes it so much.
Yeah. Mr Gray, and it's a real pleasure to serve under your chairship this evening. The future of the NHS hangs in the balance, and this petition is entirely correct in calling on the government to renationalise the NHS, scrap integrated care systems and end private finance contracts. The Health and Care Bill threatens to open the floodgates to further privatisation by implementing a healthcare model that incentivises cuts and closures and rations funding to health boards, while also welcoming private profit-driven companies like Virgin and Serco onto the boards of integrated care systems, giving them a say on where NHS money gets spent. This new legislation will further dilute the voice of patients and the public, with new boards covering populations of up to 3 million people. They will be remote and centralised, with no obligation to be open, transparent or accountable to ordinary people, and will seriously restrict power.
She's making an excellent speech. Would she agree with me that... Catherine West. Would she agree with me that we might see a repetition of the $4 billion which was wasted by this government during COVID if we have that lack of transparency and that fear around related party transactions where people know exactly where the money's going and it's into their pockets?
Kim Johnson.
I thank my honourable friend for her intervention, and I fully support what she has said. And they will be remote and centralised, as I've just said, and ordinary people will be seriously restrict the power of local authorities to protect local services. And with these changes, private healthcare giants will only have a bigger say over the NHS. They'll be granted contracts with even less scrutiny than they do now. By opening the door to private healthcare providers to take decisions on NHS budgets and services, this bill makes it easier for public health contracts to be distributed to private providers with less transparency and accountability. And safeguards currently in place in the public contract regulations will be excluded, watering down protections around employment and environmental provisions in procurement processes. And there's no doubt that this bill will put on steroids the cronyism we've seen in this pandemic, while our NHS heroes have worked day and night putting their lives on the line. This government has cut real pay for nurses while handing out billions of pounds of contracts through an illegal VIP system to its mates and donors and the failed track and trace system. The NHS is the jewel in the crown of our public service, our proudest achievement, but 12 years of Tory austerity and now the pressures of the pandemic have stripped it to the bone. An unbelievable £100 billion has gone to private providers of healthcare in the last decade alone. And the last thing it needs right now is a dangerous overhaul that puts the private sector at the heart of a health service. And we must take this and every opportunity to support amendments to the bill that establish the NHS as the default option for all NHS contracts to mitigate the worst parts of the bill. We must stand up to these new attacks or risk losing the NHS to privatisation by stealth. And we must go further in our demands to roll back the damage done, to reinstate the NHS as a truly national service and establish a fully integrated national care service with staff and patients at its heart. Thank you.
Inbound.
Thank you, Chair. It's a pleasure to serve under your chairship. The privatisation of the NHS has been a lengthy and well-documented process which started during Thatcher's Conservative government in the 1980s. It shifted the responsibility for long-term care of the elderly and the vulnerable from the NHS to local authorities and allowed hotel-type charges for long-term care. This violated a key NHS principle that patients should not pay health charges. Charges became means-tested and homes had to be sold to pay for the bills. Local authorities were forced to pass their responsibility for healthcare to outsource private companies. This created a for-profit industry worth £6 billion a year. 90% of nursing bed homes are now operated on a for-profit basis. Almost 400,000 elderly patients are now a source of income in an increasingly privatised sector. The staff in these nursing homes have an increasingly casualised and de-skilled workforce. Privatisation of care for the elderly has created such a mess, we're still trying to sort this out 40 years later. This is the shameful legacy of privatisation in one sector of healthcare. And we can see clearly that the process of privatising the NHS itself will follow the same pattern. It will be run by private contractors who deprofessionalise and casualise the temporary workforce. There has been a creeping privatisation of the NHS. In 2012, an act was passed that, amongst other things, required all NHS contracts to be tendered to any qualified provider. So now we have ambulance services run by taxi firms. Private companies have taken over GP practices covering 500,000 patients in London, and a private company took an NHS hospital and cancelled the contract when there was no more money to be made. I have seen firsthand, working for Unite, organising in the health sector, outsourced workers, the damage privatisation does to our essential care services. If this tale of incompetence wasn't enough, the government is pushing through a new reorganisation. This time to establish what they call integrated care, which does the complete opposite, butchering our NHS into 42 separate areas. It should not be called integrated care, but disintegrated care. Each area has a fixed budget which cannot be overspent. This will create a postcode lottery and force each area not to cooperate with each other to save cash. Each area board will allow private healthcare companies to make decisions about the provision of healthcare. Again, another play on words. These companies are mostly private health insurance companies. So here we go again. The government's answer to underfunding our NHS is to let private companies run it. History has taught us that this is not the solution. NHS staff employed by 42 different organisations face a most uncertain future. Casualisation, de-skilling and the introduction of poor terms and conditions. The people of England face a regional, not a national health system, which will have different terms and conditions for its workforce and different provision of treatment. Chaotic, wasteful and irresponsible. Every government of the day has been entrusted to preserve and protect one of the country's greatest achievements, to cherish, not cherry-pick, and harvest off to the private sector. I urge the Minister to listen to the calls of my constituents, campaigners and trade unions and scrap the catastrophic health and care bill which destabilises, fractures and imperils our NHS. Thank you, Chair.
Excellent. Middlesbrough, I fear we have no time. I do apologise. And I do also apologise to the Honourable Lady on Hornsey Wood Green for getting her name wrong. Extremely stupid of me. I do apologise. Steve Bonner.
Thank you very much.
pleasure to see you in the chair today, and I thank the petitioners who signed E-petition 598732. The position of the SNP on this matter is clear. The NHS was created to be free at the point of use and to treat all citizens equally from cradle to grave. That's the NHS that we want to see back, an NHS for the people, by the people, and firmly in the hands of the people. Because despite the fact that the government lack a democratic mandate to privatise the NHS, vast sums of public money are being wasted on business managers, private providers, PFI debts, multinational accounting firms and corporate consultants. By enshrining privatisation in NHS England, the Tory government continue to jeopardise access to care and universal standards. Looking at the issue for social care, for example, Mr Chair, Scotland has successfully integrated health and social care services in Scotland since 2014 and has put in record investment to allow for continued quality improvements in services year upon year, and this is without any privatisation. This has been achieved even with the culture of cuts to public services that have been forced upon Scotland by Westminster austerity agendas. So if Scotland can create a social care system that works with one hand tied behind our back, what is England's excuse? And we've heard honourable members refer to dental health and the lack of it in England, and of course in Scotland we have made provision again for free NHS dental health care for 18 to 25-year-olds in our last manifesto, and that's coming through the Scottish Parliament just now. That's on top of our free annual and biannual eye care tests for everybody, because these are the things that matter and can actually have a better effect on the management of our NHS and clogging up any appointments. The COVID, for the UK government, it seems that healthcare is indeed a hassle. For the Scottish Government, it has been our priority. The COVID crisis has demonstrated why the NHS is our most important public service, and Scotland has recognised that. We gave our NHS workers a bonus there as we came out of the pandemic. The Scottish Government has also put record funding into our health and social care services of up to £18 billion, with the resource funding up 90% under the Scottish Government. Frontline health spending in Scotland is £111 higher per head in Scotland than it is in England. These figures speak for themselves. The government in Holyrood has a history of making different parts of the health and social care system work together. It has used legislation to get these efforts underway, and we contributed to the betterment of the UK system by voting against the Health and Social Care Bill going through the House. The bill gives the UK Health Secretary enormous powers over NHS England, over its structure, over its functions and its budget, giving him more leeway during trade negotiations, with particular risks from American healthcare interests. Such ministerial control over NHS England is concerning, as these will have long-term consequences for the NHSs in Scotland and the other devolved nations, particularly in terms of funding and what is included in any free trade agreements. The bill also eliminates the requirement for competitive building and allows NHS bodies to award some contracts directly. Can't you imagine if in future care for your family, your friends, children or relevants, we're all dependent on how much money is left in somebody's locker, as opposed to whose expertise and resources are best to deliver it. The SNP has been quite clear that those in charge of services should only have the best interests of patients at heart, not the vested interests of private healthcare. Appreciating our healthcare system, in particular its staff, who have been invaluable to every member of our society before, throughout and will be after the COVID pandemic has thankfully gone. We heard Mr Pelle Gustafsson, the CMO of Swedish Patient Insurer, when he was asked which country he would hold at the very top pillar with regards to patient safety. He replied, quoting, "If you take all preventative work in regards to patient safety, I will say Scotland. I'm personally very impressed with Scotland. I think in Scotland you have a long tradition of working together, you have a department and a development in the right direction, and you also have a system which is fairly equal all over the place. You have improvement activities going on, so I'm very impressed with Scotland." So if the Minister has listened to that, this is the NHS, and the UK Government could do more and should be using that as a basis to drive improvements for health and social care sector across these nations, because if they don't, we are at very real risk of doing their citizens the greatest injustice this country has ever seen. Here.
Thank you very much, Mr Gray, and it's a pleasure to serve under your chairmanship. This has been a spirited and emotional debate, and one that captures, I think, the unique place that the NHS holds in the heart of this nation. I want to personally thank, on behalf of the Labour front bench, the petitioners and the campaigners behind the petition, because the NHS is more than just an institution. It is an example of the difference that politics, society and individuals can make. It gives us hope that governments can make real differences to people's lives, so long as there is the requisite willpower and determination to do so. Over the last 12 years, the NHS staff have had to move heaven and earth just to keep this service on its feet. They have faced extraordinary upheaval, underfunding, neglect and government mismanagement. And I would like to place on the record my thanks to all NHS staff at every level for the work that they've done, not just over the last 12 years and before, but particularly in the last 2 years when we were hit by the COVID pandemic and the NHS was placed under enormous strain. I am in awe of the work that the staff have done. But I am angry that they have had to step up to try and mitigate the failures of this government. Because even before the pandemic, the scale of the crisis in the NHS was stark. COVID has compounded these problems, but it did not cause them. Any attempt by the government to blame COVID for the state of our National Health Service is nothing more than an abdication of responsibility. Now, this debate is about the future of the NHS, but to understand the future, you have to understand how we got here in the first place, and how the steps we need to take are informed by principles that have been too easily forgotten by the Conservative government. The NHS is Labour's finest moment. Emerging from the tragedy and the upheaval of World War II, the British public decided to put their faith in a Labour government. British people suffered from endemic health inequalities, squalid living conditions, and were bearing the brunt of decades of public health neglect. The NHS, spearheaded by the great Aneurin Bevan and Clement Attlee, aimed to change all of that. Many said it couldn't be done, but it was done. It was done through the courage of conviction and a belief in the necessity of a service based on need rather than income. A simple principle, revolutionary consequences. So now we find ourselves in 2022, almost 74 years on. If the Labour pioneers who built our health service were here today, what would they see? They would see record waiting lists, an acute staffing crisis, morale at its lowest ebb. They would see health inequalities growing and a government fundamentally incapable of addressing its own failings. Yet if they twisted the dials of their time machine to 2010, they would see an NHS in pretty healthy condition. Waiting times had dropped. Public satisfaction was at the highest level ever. Hospitals were staffed at record numbers. In 12 years, that progress has been systematically undone. The first priority of the next Labour government, then, will be to sort out the immediate mess that the Tories have left our health service in once more. That means throwing everything at slashing waiting times and reducing the care backlog. It means recruiting, training and retraining the staff we need across the NHS and social care. The last Labour government brought waiting times down from 18 months on average to 18 weeks. We will have to do the same again as a matter of urgency. But all of this must come alongside a long-term plan for the care workforce, as well as wider reforms to fix social care. Yet the government's doing none of this. Instead, it's faffing around with an unnecessary and distracting top-down reorganisation of the NHS in the form of the Health and Social Care Bill, whilst doing precious little to tackle the waiting lists and address the staffing crisis. Now, I'd be grateful if the Minister could recognise these concerns in his response and outline what steps the Government will be taking to ensure that any NHS reorganisation comes alongside a proper plan to address soaring waiting times and critical staffing shortages. But the future of our NHS is more than just about addressing the immediate crisis. It's also about adapting to the needs of our population and recognising that health is more than just about surgeries and hospitals. Last week in this Westminster Hall, I spoke about health inequalities and about how health is all too often viewed as an isolated issue without considering the external factors that influence our well-being. Well-being is linked to our communities, our access to green spaces, our mental health, our opportunities, and so much more. If we fail to consider these influencing factors, then our health service will always be geared to address the symptom as opposed to the root cause of the symptom. That's why the future of our NHS relies on prioritising preventative health measures. One example of this is Labour's recent announcement that we would recruit more than 8,500 mental health professionals to support 1 million more people every year. This is exactly the kind of progressive, proactive and preventative policy the Government should be driving. This investment in mental health would mean that every community would have access to a mental health hub for young people, and every school would have a specialist support. This means that well-being is addressed beyond the clinical setting, and the health consequences of stress, depression and anxiety are addressed before they reach the hospital waiting room. So far, I've seen little evidence from government that they realise the importance of preventative health measures. In fact, I would go as far as to say, Mr Gray, that the withdrawal of funding from community centres, green spaces and sports clubs over the past 12 years have actually shown that the government isn't really sensible or serious about preventative health policy. Maybe in his response the Minister could correct me on this and advise how the government intends to reverse its disastrous cuts to local services, which have seen a calamitous impact on health outcomes. Our NHS was built to provide security. It was built to recognise that our prosperity is innately linked to our health and that we deserve to live long, fulfilling lives, all of us, irrespective of our background or where we've come from. It is an issue of basic respect. To be healthy and to have access to care is not a privilege. It is a fundamental right of every human being, a right that we expect the government to protect and defend at all costs. It is the job of the government of the day to pass the National Health Service on in a better condition to that which they found it when they came to office. And I'm afraid to say, Mr Gray, this government has failed in that obligation massively. I am hopeful, however, that with the right support, the right investment, the right approach and the right values, because values matter when it comes to our health and well-being, that Labour can undo years of neglect and equip the NHS with the tools it needs to survive and then thrive. That day, Mr Gray, can't come quickly enough.
We have a few moments in hand, so unusually, but I'm told perfectly within order, I'm going to call the Honourable from Middlesbrough for a brief contribution. Donald.
Thank you, Mr Gray. I'm very grateful to you for the accommodation. I declare my interest as a proud member of Unite the Union. The level of involvement of private interests that's built up in our NHS over decades is deeply troublesome, and the concern has been forcefully expressed and set out in the demands in the petition that we're debating today, and that's garnered over 135,000 signatures. In our manifesto, Mr Gray, at the last election, Labour stated our urgent priority is to end NHS privatisation. That was because every penny spent on privatisation and outsourcing is a penny less spent on patient care. We committed to repealing the Health and Social Care Act and reinstating the responsibilities of the Secretary of State to provide a comprehensive and universal health care system. We also committed to ending the requirement on health authorities to put services out to competitive tender and ensuring services are delivered in-house and bringing subsidiary companies back in-house. Mr Gray, I want to address the issue of PFI in the moments remaining to me. And the Honourable Member for Stockton South set out a lot of the detail very accurately. He told us about the hospital in my constituency, James Cook University Hospital. And I've got to pay tribute to the work that all of that team, so superbly led by Sue Page, the Chief Executive, that hospital has performed marvels during this period and offered services to other hospitals across the entire north of England. And I'm appealing to the Minister today for some help for my hospital, because that burden of the PFI has been absolutely colossal. They've cost it £1.5 billion to build and maintain it since it opened in 2003. And the amounts paid by the Trust increase every year until the final payment in 2034. And quite frankly, I don't want to get into the debate about how rotten the PFI deal was. All PFI deals were rotten. And you know, they were started in 1992 under a John Major government. So please, let's not have any of that nonsense. It does cost an absolute fortune. It costs 20 million more than an equivalent hospital would have to pay on maintenance. But what was missing was, what are we going to do about it? As an initial solution, we could look at the decisive action of the department in 2012 to make £1.5 billion available in grants, not loans, to 7 hospitals in England with some of the heaviest PFI debts through a stability fund. And the 7 trusts were able to use the money to meet their PFI payments rather than their usual budgets. It's been done elsewhere, Mr Gray. I'm appealing to the Minister if he would look very carefully at assistance to get this PFI albatross from around our neck and let my hospital thrive and continue to do the wonderful work that it's been doing for these years. Thank you, Mr Gray. I'm most grateful.
Argar.
Well, thank you very much, Mr Gray. I pay tribute to my honourable friend, the member for Stockton South, on behalf of the Petitions Committee, for bringing this debate before us today. I'm pleased that we were able to find time for the honourable member for Middlesbrough to come in. I'd offered that if he intervened on me, I would take that intervention. I suspect, as ever with him, that would have been a brave offer on my part, given the intervention that might have come my way. So I'm pleased that he got to give his. His speech. And I'm also, as ever, grateful to the Shadow Minister. I think this is the first time we've properly been opposite one another since his appointment to this role in the opposition front bench. And although I didn't agree with everything he said, he made a typically well-informed and well-argued contribution. He's right to pay tribute, I think, to all members who've spoken today, whether one agrees or not with the positions advanced. This has been a passionate debate, because at the heart of it is one of the, if not the most precious, of our country's institutions. And understandably, honourable members, and right honourable members, and our constituents all have very strong views on this subject. I'd also, before turning to the substance of the debate, pay tribute. While I may not agree with the contents of the position, I would take the opportunity to pay tribute in a broader context to the work of Unite Unions and other trade unions. I don't always agree with the stance they adopt, but they play a hugely important role in our democracy and in our society, and it's right that I put that on record. I'd also put on record, as I always do in these debates, and as the Shadow Minister has done very clearly, our gratitude, I think, which applies to both sides of the chamber equally, to all the staff in the NHS, social care, local government, and indeed key workers across the country, for what they've done over the past 2 years, but indeed what they do every year, day in, day out. Now, this bill, as I've said before, is one which reflects evolution, not revolution, and it supports improvements, I've said before, already underway in the NHS, and crucially, it builds on what the NHS itself recommended and consulted upon back in 2019. It's backed, as I've said before, not only... If I may just make a little progress, I'll always give way to the honourable lady, so I'll make a little progress and then I will, of course. Not only by the NHS, but of course many others, as I've said before, working across health and social care. And a joint statement from the NHS Confederation, NHS providers and the LGA reads, "We believe that the direction of travel set by the bill is the right one," noting that, of course, local level partnership is the only way we can address the challenges of our time. Of course, I give way to the honourable lady.
I thank the Minister for giving way. He's talking about the consultation. As I recall, the consultation took place over the Christmas period when NHS staff were absolutely exhausted. He talks about, you know, these changes being requested from the NHS, but I would ask him, what percentage of NHS staff does he actually think took part in the consultation?
I'd say to the Honourable Lady, as she will know, that speaking of the NHS, the former Chief Executive of the NHS, Lord Stevens, was clear in saying the overwhelming majority of these proposals are changes the Health Service has asked for. I believe it's right we do the right thing by them and patients, and it's the right time for this bill. It's the right prescription at the right time. Now, the petition, turning to the substance of the petition, which has framed many speeches by honourable members today, calls for the government to renationalise the NHS. Well, I have to say, it's never been denationalised. The NHS is and always will be free at the point of use, and the government is committed to safeguarding the principles on which the NHS was created. The honourable gentleman, the Shadow Minister, set that out very clearly and has no plans for privatising it. I'll make a little bit of progress, then if I have time I will give way to the Honourable Lady, who many years ago I sat with on a committee of London councillors when we were looking at social care reform way back then, in 2010 I think it was. We all recognise the importance of preserving this great national asset for the future, and the importance of ensuring that the NHS remains comprehensive and free at the point of use, regardless of income, on the basis of need. And the government remains steadfast in its commitment the NHS is not and never will be for sale to the private sector. Now, we are determined to embrace innovation and potential where we find it, but that's very different from many of the accusations and speeches we've heard today. And I know it's tempting to scaremonger and to set out accusations about what this bill does, even when people know better, and I know honourable members do. But that reflects scaremongering rather than reality. There has always been a provision, an element of private provision in healthcare services in this country, and they should know that because, as the Nuffield Trust said in 2019, the evidence suggests the increase in private provision originally began under Labour governments before 2010. And I'll make one more point on this, and then I'll give way to I'll just finish this point and then give way to the Honourable Lady for Hornsey and Wood Green. And I know that the Honourable Member for, this is where I may get his seat wrong, Liverpool West Derby, I think it is his seat. Thank you. It's important to look, and the Honourable Member for Middlesbrough touched on this, at actually the extent to which that privatisation, that involvement of private sector providers, accelerated when the party opposite was in power. So the Honourable Member talked about the 2012 legislation and any qualified provider, but that was not brought in by the 2012 legislation. It was brought in by the Gordon Brown government in 2009 to 2010 under the term any willing provider. The name was changed, but nothing substantive changed from what the Labour government had introduced in terms of the ability to compete for contracts. One more sentence and I'll give way to the Honourable Lady, and then I'll try and bring the Honourable Gentleman. The other point I would make, of course, is that one of the key changes allowing private sector organisations to compete for and run frontline health services came in 2004, again under a Labour government, when the tendering for provision of out-of-hours services by private companies was allowed. Of course, I'll give way to the Honourable Lady.
The Minister is being very gracious. How is the bill going to make sure that there's no conflict of interest between private providers who sit on integrated care boards and who then provide services, or are we going to end up with another Randox scandal?
Well, I'm grateful to the Honourable Lady. She will know that integrated care boards, we, as a government, introduced an amendment building on the already clear provisions in the bill to prohibit conflicts of interest. I don't know whether she voted or not for the government amendment, but it did exactly that, making it clear at report stage that private providers and those with significant private interest could not sit on the NHS integrated care boards. I'll give way to the Honourable Gentleman.
He is indeed being generous with his time. Let's just get the history right. The reason that the Labour government increased the involvement of private sector bidders was simply to be able to get increased capacity quickly, to get the waiting list backlogs and waiting time backlogs down, which they'd inherited from the previous Conservative government, which were massive. And in terms of the 2009 bill, I seem to remember that there was a provision in there that will give preference to NHS bidders.
On his point, I'm grateful to the Honourable Gentleman who, although we occasionally cross swords in the chamber or in here, he knows I have a great deal of respect for him. All I would say, gently, is that the point about the 2004 changes came 7 years into a Labour government. So what their reasoning was that they haven't been able to make progress before then, we will see. I'll make a little progress, if I may, Mr Gray, but I'm grateful to the Honourable Gentleman. We continue to work closely with the NHS to implement the changes they have asked for so we can build back better and secure our NHS for future generations. As the Shadow Minister quite rightly said, The COVID-19 pandemic has tested our NHS like never before, and all of our NHS staff have risen to meet these tests in extraordinary new ways. And honourable members have raised the point about the pressure that NHS staff have been under. Honourable members on both sides are absolutely right to highlight that. Those who have been under pressure dealing with this pandemic, of course, are the people who will also be working flat out to deal with waiting lists and backlogs. And we need to make sure that we are honest with the British people, that we need to make sure that those staff have the time and the space to recover emotionally and physically from the pressures they have been under. And I think that's hugely important. We acknowledge the workforce is. I won't give way to the Honourable Lady now. I've given way to her before. I'll try and make a bit of progress. If time works, I will try to. We've seen innovative new ways of working, new teams forged, new technologies adopted and new approaches found to old problems. And there's no greater example of this than the phenomenal success of our vaccine rollout. And of course, that would not have been possible without the staff, who are the golden thread that runs through our NHS. And as we look to the future in a post-pandemic world, again, as the Shadow Minister said, we know there's no shortage of challenges ahead of us: an ageing population, an increase in people with multiple health conditions, and, rightly, as he says, the challenge of deep-rooted inequalities in health outcomes and the need to look at that broader context. Forgive me, I don't know the Shadow Minister as well as I knew his predecessor, but both his predecessor and I had a career in local government as councillors before. I suspect the Honourable Gentleman may have done. He will therefore know that I understand the point he makes about that broader context. Can I make a little more progress? And then, if I can, I'll try and give way to honourable members. There is, of course, more that needs to be done, and we are giving the NHS the support they need and have asked for to do it. In addition to our historic settlement for the NHS in 2018, which will see its budget rise by £33.9 billion a year by 2023-24, we've pledged a record £36 billion to be invested in the health and care system over the next 3 years. This funding will ensure the NHS has the long-term resources it needs to tackle the COVID backlogs and build back better from the pandemic. Mr. Very briefly, if I may. Very briefly.
The person who just the honourable member referred to recruitment within the NHS. Can I ask the Minister, what is the government's response to that to ensure that we have the recruitment and the staff are in place?
Well, as the honourable gentleman will know, we have, I think, 1.2 million full-time equivalents in the NHS. That's a record number of staff. Take one example, our pledge for 50,000 more nurses by the time of the scheduled next election, 2024. Last year alone, we saw the number of nurses increase in our NHS by 10,900. We have that plan in place. We are recruiting more staff and we're training more staff through increased numbers of places, for example, at medical schools as well. We know, I won't because I've got 2 or 3 minutes. If I make sufficient progress, I will try, but I can't promise the Honourable Lady. We know that different parts of the system want to work together and deliver joined-up services. And we know that when they do, it works. We've seen that with non-statutory integrated care systems these past few years. The petition calls for the government to scrap integrated care systems, but to do so would be to let down our NHS. These reforms have been developed by the NHS. Integrated care systems are already in place. This places them on a statutory footing to allow for that integration and that joined-up working to continue. In the minute or two I've got before I hand back to my honourable friend, the member for Stockton South, I just wanted to touch on PFI contracts, which I know he and other honourable members have raised. In 2018, the government announced that PFI and PF2 will not be used for any future public sector project, and that includes those in the NHS. The government will honour existing PFI contracts, as wholesale termination would not necessarily represent good value for money. We need to look at each on its merits because many have clauses for early termination which would cost a lot more than the life of the contract. But we have committed to work to undo the worst of the contracts inherited from the previous government. I just gently say to the honourable member for Chester, and I hope he'll let me tweak his tail a little on this, he chided my honourable friend, saying be careful about references to PFIs. Of the 124 significant PFIs currently in place, 122 of those were signed between 1997 and 2010. I'm conscious, Mr Gray, I think you want me to give my honourable friend a little time, so I will conclude by saying we believe that this government is doing everything necessary to ensure the NHS remains free at the point of use. We are working with the NHS to deliver what they have asked for through the Health and Care Bill. There is huge support from those working in the system for the direction of travel. This will create a more efficient, integrated and less bureaucratic healthcare system, and allegations that this is privatisation by the back door are simply misleading. We will ensure through this legislation better and more joined-up services, improving health and care outcomes for all, sir.
Matt Vickers.
I'd like to thank you, Mr. Mr. Chairman. I'd like to firstly thank the 135 petitioners for triggering this important debate today about our most essential and treasured service. I'd like to thank members for their valuable and emotional and passionate contributions, and the Minister for what was a comprehensive response. The NHS is a great British institution, and we should be proud of it. From Borough to Burnley, our NHS staff are rightly celebrated as heroes. It's their dedication that got us through the pandemic and that will help us reach the 6 million people on our waiting list. We owe them a gratitude that cannot be expressed in words. Dentistry remains an issue for constituents across the UK. I look forward to the debate on NHS dentistry, which I understand is to take place in the near future. I'm delighted the NHS has the biggest cash boost in its history, delighted to see thousands more doctors and nurses working in our amazing hospitals. I look forward to more debates on the NHS so that we can continue to appreciate, extend and improve our great British NHS. Thank you.
The question is, this House considered E-petition 598732 relating to the future of the NHS. Is there anyone who can say aye? Aye. Contrary, no. I think the ayes have it. The ayes have it. Order, order. Is that right? No.
The proceeding has ended.